Creating more places where people can just walk in and get care and not have to kind of go through so many steps to find somebody. I think we need more of that. You know, we're always going to be working within systems, but trying to make those systems better over time and trying to make them more streamlined so that they communicate with each other and work well together. I think that's a big part of what doesn't work now, is that there are just so many moving parts. I'm hopeful that over time, these are things that we can work on improving. Well, I work at a mental health urgent care, and most of the patients that I work with are underinsured and don't have very good access to care. And what I love about working in an urgent care is that we really never know who's going to walk through the door or what their circumstance is when they're walking in. We get a range of people, from people who have never sought mental health care before, and this is the very first time that they've ever done this, and that can be a really daunting or intimidating experience for them, to people who have been connected to care in the past, but maybe that connection has been broken, especially during COVID and the pandemic, or for various other reasons within our systems that cause a breakdown in that connection. And you know, one of the things that I love about doing that work is being able to be there for them when they don't really know where else to turn. I think there's so many things in my life that led me to where I am right now and my interest in working with underserved communities. This all probably started because of my parents. My father grew up without access to good health care. He came from a communist country, and my mother, on the other hand, was always very passionate about mental health and working with underserved patients. As a psychologist for many years, working at a state hospital, she really showed me how important mental health was. She really showed me how important kindness was. And you know, not all Asian Americans, especially with parents who are first generation, really understand mental health. And I think I was fortunate because my mother was always a very strong advocate for that. I also took kind of a non-traditional path to become a psychiatrist because I have a background in social work. And part of my social work training was an internship during which I worked with HIV patients. And that was a life-changing experience for me. I was able to work very closely with my clients then and really get to know them. Those patients shared incredible stories with me about their lives and everything that they've been through. I think that something that came up over and over again as a theme was the idea of being stigmatized by their community and even sometimes their families. And that was really heartbreaking for me to hear. And as a young social work intern, it really compelled me to want to do more work with these populations. Growing up, I was really involved in the Asian American community and faith-based communities within the Asian American community. And I noticed that a lot of those spaces weren't very safe for certain populations, especially the LGBT community. It was really heartbreaking for me to see that. And that's something I feel really passionate about, is trying to create safer places for not just them, but people from all backgrounds who, again, might have experienced stigma wherever it is they're coming from. My patients are important because they are individuals with complex backgrounds and problems and concerns that I have the privilege of hopefully helping them to walk through. I consider myself very fortunate to be able to do that with them, and I understand that sometimes I might be the only person that they have to walk through that with. I believe that we're always learning from each other, and you know, they teach me things, and I gain a lot from hearing about people's experiences and what they've gone through and how they've come through some of these unsafe spaces and how to be a better psychiatrist in serving them.